My name is Rose. Smoking caused my lung cancer. The most painful thing that I went through was the chest tube to get the fluid out of my lungs. It was just bloody, bloody, bloody. Every day I prayed that they would remove it. The last 3 or 4 days, I literally cried. My tip is, be careful what you wish for. That chest tube hurt a lot more coming out than it did going in.
You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.
Hello, this is Joyce Petro. Welcome to this edition of Healthy Living with Tobacco-Free Allegheny. Cigarette smoking is widely recognized as the biggest risk factor for developing lung cancer, and today we'll be talking about lung cancer in our state. Lung cancer is the #1 cancer killer in both men and women in Pennsylvania. In 2011, lung cancer was the most frequently diagnosed type of cancer among Pennsylvania residents and was also the most common cause of death from cancer in Pennsylvania. Pennsylvania's lung cancer rates are higher than the national average, but there are efforts underway to prevent and reduce lung cancer. Our guest today will talk about lung cancer in Pennsylvania, what you can do to prevent it, and who should be screened for it. Our first guest is Joanna Stoms. Joanna is the Cancer Plan Manager for the PA Department of Health, Division of Cancer Prevention and Control. She's been with the division since January 2014, and her background includes serving as the Secondary Partnership Coordinator for Harrisburg Area Community College and many years' experience as a registered respiratory therapist. She has a Bachelor of Science and a Master's in Public Administration from Penn State University. She lives in Harrisburg with her husband, 2 college-age daughters, and 1 very large greyhound. Welcome, Joanna, and thank you for being with us today.
Thank you, Joyce.
What is the incidence of lung cancer in Pennsylvania?
The incidence in lung cancer in Pennsylvania, and I just want to mention that the incidence rate is how many cases are diagnosed. For Pennsylvania, the incidence rate is 65.3, and I also wanted to mention the mortality rate, which is the death rate, that is 47.4.
What about the incidence in Allegheny County?
The incidence in Allegheny County is much higher than the incidence rate for Pennsylvania. It's 72.2, so it is quite a bit higher than the national rate, or I'm sorry, the state rate.
And so how do the state rates and the county rate compare to the national rates?
Well, the U.S. incidence rate for lung cancer is 58.7, and the U.S. mortality rate is 47.2. Pennsylvania rates are generally higher than the national lung cancer rates. So there is definitely a higher incidence of lung cancer in Pennsylvania and in Allegheny County than the U.S. rates.
Are there differences in the rate of lung cancer between men and women, or males and females?
Yes, for Allegheny County, the age-adjusted incidence rate is 83.5 for males and 64.7 for females. So the male rate is definitely higher than the overall rate.
So once an individual has been diagnosed with lung cancer, what are the mortality rates?
In Pennsylvania, the mortality rate overall is 47.4. In Allegheny County, the overall mortality rate is 66.7 for males and 42.2 for females.
When you speak of the rates, are those numbers per, how do we interpret those numbers? Are they per a segment of the population?
The rates I'm referring to, they're all age-adjusted 3-year summary rates. Generally, when we look at incidence and mortality rates, it's helpful to look over a 3-year period. So that kind of gives us the best indication of what the rates are for that area. So the rates I'm quoting today are for 2010 to 2012, except for the United States incidence rates, which are a 5-year rate. And when we talk about an age-adjusted rate, age adjustment is a statistical process applied to rates of disease, death, and injuries or other health outcomes, which allows communities with different age structures to be compared. So those are the rates that I'm quoting today, and that's generally how they are quoted in different studies.
Okay. Can early screening and detection reduce the mortality rates from lung cancer?
Absolutely, yes. According to the National Lung Cancer Screening Trial, The receipt of 3 annual low-dose CAT scans was associated with a 20% decrease in mortality in those at highest risk for lung cancer.
So can you describe the kinds of screenings that should occur and who should receive them?
Patients identified as high risk should receive a low-dose CAT scan. They should not receive a chest x-ray. Chest x-rays have not been found to be very effective at identifying lung nodules, so what is recommended is a low-dose CAT scan. And lung cancer screening should be reserved for patients that are considered high risk. And I'm going to talk a little bit about what Medicare considers high risk, and other trials that have been done are very similar to what Medicare has considered high risk. There might be some difference in the ages and the pack year of history, but it's all kind of within that age range. So a patient is considered high risk by Medicare when he or she meets the following criteria. The patient is between 55 and 77 years of age, has no current signs of lung cancer, because remember, this is a screening tool, not a diagnostic tool. So it's a screening procedure, not something that's to be diagnostic. Has a 30-pack year of history of smoking. So what that means that a person would have to smoke 1 pack a day for 30 years or 2 packs a day for 15 years to have a 30-pack year history. And the person should be a current smoker or one who has quit within the last 15 years. So that is what we consider, or Medicare considers, a high-risk patient and would be eligible for lung cancer screening under Medicare.
Are there ways to prevent lung cancer?
Yes, there are. There are definitely ways to prevent cancer. The most common risk factors are tobacco use. So tobacco use is the #1 cause of lung cancer throughout Pennsylvania and throughout the United States. So it's very important for people to know that if they are smoking, to stop smoking. That would be the #1 way to prevent lung cancer. And for those that are young, to quit smoking as soon as possible. Lung cancer is not one of those diseases that occurs overnight. It takes a long history of smoking in order for lung cancer to develop. So the earlier that you can stop smoking or not smoke at all, the less your risk of lung cancer being developed. The other thing that we could also recommend for you doing is to have your home tested for radon. Radon is the second leading cause of lung cancer next to tobacco smoking, and Pennsylvania is considered a very high radon state. In fact, 40% of the homes in Pennsylvania have a rate of 4 picocuries per liter of radon, and that is considered enough for mitigation or remediation. In other words, you should have your home treated for radon. The other thing to do is to protect yourself from workplace exposures such as asbestos, radioactive ores, inhaled chemicals, minerals, diesel exhaust. Anything that you could be inhaling into your lungs could put you at risk for lung cancer. And for those folks that have exposure to either radon and these workplace exposures and smoke, your risks are even greater. So it's very important to know that.
So all of the things that you just mentioned would be the most common risk factors for developing lung cancer?
Those are what we consider the most common risks of lung cancer. And the other one I did not mention would be exposure to secondhand smoke. That is also a risk for lung cancer.
So what if I've never smoked, but I live with someone who smokes, or I work in an environment where there is smoke? Am I at a greater risk for developing lung cancer?
Yes. According to the CDC, the Centers for Disease Control and Prevention, secondhand smoke causes lung cancers in adults who have never smoked. Non-smokers who were exposed to secondhand smoke at home or at work increased their risk of developing lung cancer by 20 to 30%. Secondhand smoke causes more than 7,300 lung cancer deaths among U.S. non-smokers every year. And non-smokers who are exposed to secondhand smoke are inhaling many of the same cancer-causing substances and poisons as smokers. So even a brief secondhand smoke exposure can damage cells in the lungs in ways that set the cancer process in motion. And as with active smoking, the longer the duration and the higher the level of exposure to secondhand smoke, the greater the risk of developing lung cancer.
Wow. So what message do you want our audience to remember today?
Well, what I'd like your audience to remember is that lung cancer is the #1 cancer killer of men and women in Pennsylvania. I think there might be a misconception that lung cancer does not affect women as much as some of the other cancers that maybe get more notoriety, such as breast and colon cancer. But in Pennsylvania, lung cancer is the #1 cancer killer of women in Pennsylvania. and it has a very high mortality rate. About of all the people that get lung cancer, 77% will die from it. So that is a very high mortality rate here in Pennsylvania. We have about over 10,000 people that get diagnosed with cancer every year in Pennsylvania, and about 7,000 of them die. So that is, I think, a very strong message to set forth to people within Pennsylvania.
Thanks very much, Joanne, for being with us today.
Thank you.
We'll be right back after this message.
I'm Christy. I used to smoke cigarettes. I had smoker's cough and severe shortness of breath, and I knew I had to quit. Then I tried e-cigarettes, but I just ended up using both. I really didn't start to get better until I quit smoking completely. My tip to you is, just cutting down on the number of cigarettes you smoke isn't enough.
Smoking even a few cigarettes a day is dangerous. You can quit. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
Welcome back to Healthy Living with Tobacco-Free Allegheny. We've been speaking with Joanna Stoms. Joanna is the Cancer Plan Manager for the PA Department of Health, Division of Cancer Prevention and Control. Joanna, we were speaking about the Pennsylvania rates and Allegheny County rates of lung cancer being higher than the national average. Why is that?
Well, I think the incidence and the death rates for Allegheny County are higher than the state average, generally because we're finding that the incidence and death rates are higher in urban areas such as Pittsburgh and Philadelphia as a whole. But it's also important to know that populations that have lower socioeconomic status and education are also indicative of higher smoking rates and therefore higher lung cancer rates. And it's also important to know that the incidence and death rates are higher for the black population throughout the state, and we have generally been finding that counties that have higher black populations will have higher lung cancer incidence and mortality rates.
Okay, again, thank you, Joanna. Joanna Stoms, the Cancer Plan Manager for the PA Department of Health, Division of Cancer Prevention and Control.
Thank you.
Our next guest today is Heather Martorella. Heather has been an oncology nurse for 18 years with experience in medical oncology, bone marrow transplantation, nursing education, and nursing certification. She's the Oncologist Nurse Specialist for Clair Hospital, a 328-bed hospital in the South Hills of Pittsburgh. Welcome to our show, Heather, and thank you for joining us today.
Thank you very much.
We understand that St. Clair Hospital has developed a pilot lung cancer screening program. Can you describe this pilot program and how it got started?
Sure. So the idea of the screening program was discussed really a couple years ago between communications at our Cancer Care Committee and weekly conferences. There was a lot of expressed interest from multidisciplines, including pulmonary medicine, medical oncology, and radiology, to see what we would need to do in order to grow a program here at St. Clair Hospital. So we evaluated a lot of our organizational data, in which we found from the years 2011 to 2013, about 15% of all of our cancer diagnoses were in fact lung cancer. And looking at that even a little bit further, we found that the majority, 60 to 70% of those, were late stage diagnoses where treatment was much more intense. So our goal there was to screen the right patients at the right time in order to discover a potential disease earlier when there's much more treatment available. As far as in discussing on how to set up the programs, one of our cardiothoracic surgeons had a great idea where he proposed that we kind of phase things in to test our processes, see what works, and what things we can change. So initially, the pilot program really was opening up low-dose CT scans to eligible employees and their spouses, in which they would receive this for free. And then again, like I said, we would test how things go and get their feedback and see how we could improve moving forward, and expanding it to patients of our St. Clair Hospital physicians, and then finally to the large community public. As far as the information that we used to frame that, it was before the CMS guidelines came out in February. So we did have some good information from the National Lung Screening Trial. So that's a National Cancer Institute sponsored study. And then some guidance from the National Comprehensive Cancer Network guidelines as far as age, eligibility, and other criterion. The patients that proceeded on to screening, they were all counseled by our pulmonary nurse educator about smoking cessation or methods to remain quit. So that pilot concluded in February.
So the screening consists of the low-dose CT scans as we discussed before.
Right. Exactly, yeah. So it's a low-dose CT scan. Those folks were provided with some information just as far as what to expect from the test, how it felt, how long it would take, when to expect their results, and moving forward with that education regarding smoking cessation. Following the screening pilot, the CMS did release those guidelines in early 2015 that Joanna did discuss as far as eligibility. So what they really stress is the idea of shared decision making between physician and patient. So there should be really a meeting before the screening is even scheduled just to talk about what those potential risk factors are for the individual. Screening patients generally should be between the ages of 55 and 74 with no active symptoms of lung cancer, either a current smoker or someone that's quit recently within the past 15 years, and then to evaluate their pack year history, which is the number of packs of cigarettes smoked over a period of time. So, for instance, for screening purposes, they require a 30-year pack history. So that would be 1 pack of cigarettes a day for 30 years or 2 packs a day for 15. So based on the findings of the scan, then there was more recommendation for either annual or more frequent follow-up.
So what is the current status or the timeline of the project? Do you have any findings or results to share?
Sure. It's a pretty fluid timeline at this point. We did conclude the pilot program, and we continue to get referrals and prescriptions in from primary care physicians. So what we're focusing on now is trying to find a really robust database in order to keep all of our information together in one place. Refine our processes and roles, really, who's responsible for what. There's great interest in the idea of incidental findings, which would be if someone presented to the emergency room, perhaps for one issue, did a chest x-ray or a CT scan and did find some different findings than what they anticipated, including lung nodules, how to track those people and follow them through time.
So what are the next steps moving forward for this project?
I think the next steps, we would really like to increase awareness of the appropriate eligibility criterion, not only for patients, but for healthcare providers. I think it's a really new area with a lot of questions yet. And certainly there's more guidance coming through every single day. But really trying to find ways to educate the public in the healthcare sector is important. We have a particularly high interest in folks that are underinsured or uninsured. How do we find those people? How do we get them screened appropriately? What are the resources available that they can tap into to have these screenings done? And then, like I said, we continue to look at good databases that are able to communicate with national registries so that there's sort of a national clearinghouse for information to be kept.
So if someone feels that they are at high risk of lung cancer, or they're concerned about a loved one who is at high risk of developing lung cancer, how would they find out more information about screening?
I would definitely have a conversation with your primary care physician or any healthcare provider that you regularly see to talk about those potential risks. Contact your local community hospitals. Many of them have fantastic smoking cessation programs. Think about ways to decrease your risk. Make sure that you're educating yourself through reliable sources of information in order to decrease your risk.
As an oncology nurse, do you have anything else you'd like to share with our listeners?
I think it's just important to keep a very open line of communication with your doctor or your healthcare provider, whoever, if it's a nurse practitioner, regarding any concerns in your health, any changes that you're noticing, and ways to continue to maintain good health. So discussing cancer screenings, not only lung cancer screening, but cancer screening as a whole is very important, and really have a good understanding of recommendations, any risks or benefits to those particular screenings, and keep yourself educated.
Thank you very much for being with us today. This is Heather Martorella, an oncology nurse with St. Clair Hospital.
Thank you.
We'll be right back after this message.
My name is Roosevelt. I always thought that cigarette smoking just messed up your lungs. I never thought that at only 45 would give me a heart attack. I never thought that it would stop me from playing basketball with my kids. And I never thought that it would change my life forever. My tip is, do your heart a favor and quit now.
Heart attack risk drops as soon as you quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.
My next guest today is Deb Brown, President and CEO of the American Lung Association of the Mid-Atlantic. Welcome, Deb, and thank you for joining us today.
My pleasure. Thanks for having me.
So tell us about Lung Force.
Sure, I'd be glad to. The American Lung Association recently kicked off an initiative called Lung Force. And the campaign is really designed to use the power of women's voices to celebrate what women can achieve with healthy, forceful lungs. And so part of the campaign really focuses on women and lung health in particular, because we find that there is a larger number of women who are now experiencing not only lung cancer, but a variety of other lung diseases such as COPD as well. And so one of the things that we need to make sure everyone is educated on is the importance of knowing that lung cancer is the number one cancer killer of women in the United States, and it surpassed breast cancer almost 20 years ago. And so I think one statistic that I know I just always am amazed at is that every 5 minutes a woman in the United States is told that she has lung cancer. And the other thing that I think is really important for the individuals listening to today's program is that anyone can get lung cancer. It's not just smokers. And unfortunately, less than half of all women diagnosed with lung cancer will be alive 1 year after diagnosis. So we have a lot of work ahead of us.
What are some of the other causes of lung cancer in addition to smoking?
So some of the other causes of lung cancer include radon, which is the number 2 cause of cancer. And the American Lung Association offers free radon kits for people who want to test their home and make sure that they're breathing in safe levels. And environmental factors certainly contribute to lung cancer in some individuals, as well as occupationally related hazards can sometimes also contribute, and sometimes just hereditary. So there's a variety of causes of lung cancer. Obviously, smoking is the number one cause, but doesn't necessarily mean that if you don't smoke that you won't get lung cancer.
What about secondhand smoke? Is that also a contributing factor?
Yes, it is. Secondhand smoke is definitely a contributing factor to lung cancer. Many of the individuals who have never smoked in their life and develop lung cancer, sometimes when you're talking with them, they'll say, well, my parents both smoked, or I worked in smoky environments. And so often secondhand smoke is a major cause of lung cancer.
So what are some of the activities that Lung Force focuses on?
Sure. We have Lung Force is broken into three components, and we look at education, engagement, and impact. So under education, we are going to paint the town turquoise with a turquoise takeover month, and that will be happening. It actually happens each May, and we celebrate National Women's Lung Health Month. So, many large and important buildings often go turquoise for the American Lung Association. We also have a women's lung health barometer, and I just will mention we surveyed over 1,000 women, and we asked them what the number one cancer killer is, and 87% said breast cancer, only 1% said lung cancer. And as I said, lung cancer is the number one cancer killer in women. We also have a lung cancer expert medical advisory panel to help guide us on diagnosis, treatment, and other related issues. In engagement, we are engaging people in lung force walks, and I know people often say, oh, not another walk, but the American Lung Association Lung Force Walk is not an ordinary walk. It really is an experience. We have a variety of tents where people become engaged, and there's a lot of interaction about lung disease and lung cancer in particular. We have a Lung Action Network, which was where our advocacy work continues. We're looking to have additional funding for research. We're looking at cleaner indoor and outdoor air, and obviously working to make sure that our environments are smoke-free so no one is exposed to secondhand smoke. And then we engage the media in our efforts. Our impact, we're working with healthcare providers to educate them as best we can on treatments, on diagnosis, clinical trials, things such as that. We have lung force expos that are held throughout the Commonwealth that really do educational programs for healthcare professionals, but as well as patients, trying to encourage patients to learn more about their lung disease, whether it's lung cancer, whether it's COPD, whether it's asthma, and really become advocates for themselves when they're working through the healthcare system. And then we're looking at lung cancer research. We have really been focusing on this at the American Lung Association, encouraging more research so that we can find a cure, so that we can help people, so that statistic where over 1/2 of individuals will no longer be here 1 year later after a lung cancer diagnosis. We want to erase that. We want to make sure that everyone has a chance to grow old and see their families grow and enjoy their life. And so research is a really integral part of that.
So how can people get involved in Lung Force?
Sure. People can go to our website, lungforce.org. They can sign up for monthly mailings. They can sign up and take a look at clinical trials if someone they know is diagnosed with lung cancer. They can gather additional information. Healthcare providers can go on there to find information as well, healthcare professionals. And so really lungforce.org is the place to find any information about lung cancer or lung force in general.
Deb, thanks very much for telling us about Lung Force and for being with us today.
Sure, my pleasure. Thank you.
Thanks for joining us today on Healthy Living with Tobacco-Free Allegheny. You're invited to listen to this broadcast by visiting www.tobaccofreeallegheny.org.
I'm Christine. I'm here to give you a tip on how to eat if you have your jaw removed because of smoking, like I did. It takes a while to eat when you're using your feeding tube, so be prepared. Make sure you have a book with you, a good, long book.
Smoking causes immediate damage to your body. You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.